This portion of New Day Northwest is sponsored by Bellevue Plastic Surgeons.
Welcome back to New Day Northwest. According to the American Society of Plastic Surgeons, breast augmentation continues to be the top choice in cosmetic surgery. Now, the numbers have steadily climbed since 2006, and Dr. George Marchand from Bellevue Plastic Surgeons is joining us this morning to explain the different options that are now out there. It is so nice to meet you, Doctor. Thank you for coming on today.
Thank you.
So, why do you think this procedure has continued in popularity?
Well, in our society, I mean, feminine figure is, you see all over magazines. I mean, it's displayed, it's desired, and so it still continues to be the #1 operation.
Requested surgical procedure,
yeah. For enhancement, and from any age, really, from age 18 up to age 50. I have patients who come in their mid-50s and they request breast augmentation. So,
so what are some of the reasons? Obviously, there's the cosmetic reason that people want,
right.
But there are probably a vast array of reasons that people come to you.
Right. Well, the younger age group, they want to look better. They want to look more feminine. And then we have the ladies who in their 30s or 40s who had their children and they underwent a little bit of volume loss in their breast, and now they want to regain the shape that they had before. So, and that's one of the main reasons they
at that point.
You know, a lot of people say, well, you know, when I go to shop for clothes, what fits here, you know, then it's too big here.
Right.
And what fits here, I can't put.
Right,
so we're looking for a balance to balance the top with the hips.
So is there some kind of counseling and talking that goes into, because you have perhaps some women coming in that have great figures and they just want more, or do you talk to them about that? Do you go through the reasoning and talk?
Right. There's a lot of discussion about this. Obviously, you know, people think, well, we just put an implant in and I'm done. Well, first of all, you have to understand that once you have implants, there's a good chance that in your lifetime you will have another surgery related to the breast. You will outlast the implant, which is a good thing. So,
right.
But because the implants have a certain lifespan, you know, they can break, they can, you know, body can form scar tissue on it. So you might need a change out of the implant or a breast lift with the implant. So there are other
it's an ongoing, yes, it's
correct.
A commitment if you choose to go this route.
It's maintenance.
Yeah, maintenance, yeah, isn't that the truth? So you've brought a couple of graphs that'll show us some of the surgical procedures and their popularity. You want to go through those with us?
Sure. So this is from the American Society of Aesthetic Plastic Surgeons, the statistics they collect yearly, and this is from 2011, and shows the top 5 surgical procedures, liposuction being #1, over 325,000, breast augmentation #2, abdominoplasty is about 140,000, upper eyelid surgery or lower eyelid surgery about 150,000, and breast lift. So really, most of it has to do with the body. And if you subtract about 40,000 men from that liposuction figure, you know, then actually breast augmentation is the #1 procedure in the country.
For women.
Yes.
So who's a good candidate for the procedure?
Well, any woman who thinks that they have small breast can be enhanced, or sometimes they come in and they just too saggy and they might just need a lift. You know, I ask them if when they have a brassiere on, do they feel like they fill it out enough, or is that okay with them, or they want to be larger? Then, you know, we can enhance them. And some women have breast asymmetry. One is larger than the other, which is very common. I always tell patients, you know, these are sisters, not twins, you know, so there's always some difference, you know.
The girls, right?
Yes.
We call them the girls.
But sometimes there's significant difference in cup size or whatever, and that needs to be addressed. Or some women have what's called tuberous breast, where narrow base breast and very large stretched out nipple areolar complexes that project forward and very narrow breast base, and they really kind of secluded and ashamed to even, you know, show that. So that can be corrected with augmentation and surgery.
So if we have the girls, you've brought some cousins. to show us what the different
That's
options
right.
are.
So
See how we're going here? Can you tell us about
So
these?
they are, first of all, they are saline implants and silicone gel implants.
Okay.
And the silicone gel implants are back on the market. They were off for some time
because they leaked, didn't they?
Well,
or?
there was some leakage, and there was some issues, attributed to silicone implants, which in the last 14, 15 years of study, not only in the US, but in the world, there's no correlation between any of those so-called adjuvant or rheumatoid type of diseases and silicone implants. But in any case, so saline implants were never taken off the market. So this is like a saline implant, and we overfill this a little bit, because if you don't, it tends to collapse. And even when I hold it up like this, see how the top collapses down. So it's now if you overfill it too much, then you end up with a very firm breast, and so that's not very good. Gel implants. This is more cohesive gel. These are softer. They tend to feel more natural. The top doesn't collapse as much as a saline. And the latest are what's called the shaped or gummy bear implants.
Gummy bear, okay.
Because it's a stiffer gel, it's more cross-linked, and as you can see, this kind of holds its shape. It does not collapse. So this was just approved this year.
Wow, so that's brand new on the market.
So it's brand new on the market.
So you just come in and ask for a gummy bear treatment, is that it?
Not everybody's a good candidate for a gummy bear.
For a gummy bear.
Certainly, there are
Swedish fish is more their style. I'm sorry. We've got to have some fun with this. Absolutely.
And they don't come in different colors. They just come in white. So.
Thank the Lord for a few small things. Doctor, I appreciate your time. Bellevue Plastic Surgeons is offering a free consultation for breast augmentation through May 15th. Just mention you saw them here on New Day Northwest when you make your appointment. We'll have all the information you need on our website right after the show. Dr. Marchand will be back a little bit later on to answer viewer questions in our Wellness Wednesday Doctors Panel. So thank you for that. We'll see you again. But coming up right after the break, nutritionist Deborah Enos shows us some great products, there she is, that are good for our bodies and our environment. Looking forward to that. Stay with us.